Welcome to this video about a very common epidemic in the 21st century, stress hormones. Brian, what are the pros and cons of stress hormones?
Well, Bob, stress hormones are necessary because they protect us against danger. But when we're listening to our cell phone or something else that's saying we need our attention now, sometimes they can produce stress response. And that can create inflammation, it can cause anxiety, it can actually provoke hair loss or other nervous disorders, Bob.
What can we do about the excessive stress hormone production?
That's a very important question, Bob. So in today's 21st century syndrome, we have this constant alert status, reminders to do everything. Lose our ability to protect our brain because we're not producing any more progesterone. This is what happens when we have this constant deluge of fight or flight response hormones, Bob.
So isn't the progesterone similar to propecia or the active substance called finasteride?
It's only similar in the fact that if you look at under a microscope, there's a carbon chain difference. Other than that, they're completely the opposite because one protects the brain and the other destroys it. If you could probably guess, which one do you think destroys the brain?
Well, I don't think our friends at Merck will be happy now, but I think it's propecia.
Right on, Bob. And progesterone, though, protects against stress in the brain. But finasteride might actually lower your protection from stress and anxiety. It might actually increase the stress and anxiety levels.
Is there anything we can add to our daily regimens to help this production of progesterone?
Yeah, so if you find yourself just agitated, full of stress, anxiety, difficult time maintaining sleep, unable to relax, just under a constant deluge of stress, you might want to incorporate progesterone cream, which is something you can buy, preferably without any parabens or additives that might be harmful. You put them on your skin, on a soft area of your body, and this will absorb and protect you. Just for what it's worth, it might reduce muscular stiffness, cramps, tremors, chronic fatigue, and other things.
And this is taken daily?
It is usually taken daily. You can certainly take a break. Best time to take a break is when you're not under a deluge of stress.
You can actually get a response very quickly.
That's correct. It can work sometimes, within minutes.
And is this a lifelong treatment or only for a few weeks or?
It can be a lifelong treatment for some people who might be genetically predisposed to producing too much of the fight or flight response hormone activity. Sometimes this is just the nature of an individual. On the other hand, it could just be circumstantial. You might have a difficult job, difficult relationship, whatever it might be. It might be something you take as needed.
And how much should we take?
You really can't overdose. You're not going to get any benefits from overdosing, but less is more for a man. So usually a man might need about 10 milligrams, women typically about 20. But if you take too much, it's not a problem. And when you approach your 50s, your need for progesterone is increased as a male because your ability to produce it is almost zero. And this could be pretty important for your prostate also.